Well, hello everyone. I'm Michelle, as I've been kindly introduced. So I'm talking about the Beyond the Smoke Rehab Support Program down at Trevor, Parry, and it's for our residents wanting to reduce or give up nicotine or vaping or cigarettes. An outline of this presentation is around 11.2% of Australians over 15 years smoke. This increases to 32% for people who live with mental illness and up to 70% for those living with more complex mental health challenges. A survey of smoking habits at Trevor Parry Centre in 2024 found that 60% of the residents were interested in reducing or quitting tobacco use. The TPC is an SA Health facility, and all SA Health facilities have a policy of no smoking on the premises. The TPC has developed its first program to support residents who are interested in quitting or cutting down to explore and create their own plan to address their tobacco use goals. There are common misconceptions about mental health consumers and smoking. They don't want to quit. Mental health consumers want to quit just as much as everybody else, and most have tried to do so at some point. Quitting will make mental health conditions worse. Anybody who quits smoking is likely to feel better, both physically and emotionally. Symptoms of withdrawal, irritability, restlessness, anxiety, difficulty sleeping, etc., are often mistaken for indicators of deteriorating mental state. There is no evidence to suggest quitting smoking makes symptoms of schizophrenia, as one example, any worse. It's impossible to change. Consumers may be facing multiple other factors that add to the challenge of quitting: lack of access to meaningful occupation, social isolation, fewer resources available to them, but quitting is possible with the right support and treatment. The reality: most of these myths are stigmatising and capitalise on vulnerabilities that we are duty-bound to address as mental health professionals. Rates of smoking in the general population have reduced over time, but not for the mental health population, broadening the disparities. Mental health consumers are already facing significant health disparities as compared to the non-mental health population. The health impacts from smoking cannot be ignored, just like any other health concern. By not addressing smoking as a health issue for our consumers, we perpetuate some of these unhelpful myths. Smoking cessation support needs to become part of our core business. So, what does the evidence tell us? What is an effective approach in services similar to ours? Taking repeated opportunities to check in with people about their smoking in a non-judgmental way. A structured approach to assessment and treatment. Assessing nicotine dependence, willingness to quit, motivational factors. Offering education, behavioural support, plus pharmacological intervention. Arranging follow-up to support motivation and assess progress. The Trevor Parry survey results. Why would you want to, as a consumer, reduce or quit? For health reasons, for family, for money, or because you stopped doing other illegal things. As you can see, health and money are hugely popular as one of the reasons that people want to stop. So what strategies have been used in the past? This is from the survey. A lot of people have tried cold turkey. Just as many have tried nicotine replacement therapy. Shampeaks, which is how I actually quit. Exercise. Vaping. Some people can quit cigarettes and take up vaping, but it's debatable whether this is a better choice. Chewing gum. Avoiding smokers. Not buying as much, and avoiding and showers and steam and eucalyptus oil. So various strategies that have been utilised. The Trevor Parry survey results So how many times have you attempted to quit? Way above 10 times, less than 10 times, more than 50 times, and millions upon millions of times, tried repeatedly. What benefits do you get from smoking? It relieves anxiety, stress relief, it provides relaxation, it decreases your appetite, gives you a relaxing break from whatever you're going through. There's many different reasons that people do smoke. So what have the TPC residents told us? The barriers to ceasing tobacco at the Trevor Parry Centre is because it's routine. You might get up in the morning and the first thing you do is have a cigarette. Stress, if you feel stressed about an appointment or something else you've got to do. Boredom, you've got nothing else to do with your time because you're addicted or because everyone else around you smokes. It affects your mood, improves your mood. It gives you some social time with the other smokers out the front of Trevor Parry Centre. It gives you something to do, an occupation, and it gives you a bit of free time to yourself. And maybe due to a lack of comfort in a situation. So, best practice smoking.
Hang on, the clicker's not working. There we go.
Thanks, Sarah. So, best practice smoking cessation and change. So, a recovery-orientated approach. The principles of a recovery-orientated approach include understanding that each person is different and should be supported to make their own choices, listened to and treated with dignity and respect. Residents can attempt to go cold turkey versus developing their own plan and supports, such as information and brochures on managing. We've got quite a few varied ones of those. They can try different ways to cut down or contact the Quit Your Way service or alternative support groups, apps. Quitline is very popular. Or involving themselves in the Trevor Parry Centre Beyond the Smoke peer support group. We also provide education and information, provided in a range of different formats and is relevant and accurate to the consumers. So, Beyond the Smoke program process. Connection, so connect the consumers to the right material and supports. Hope, affirming their goals and aspirations. Identity, actioning new habits and behaviours. Meaning, to design and co-author a tailored plan. And empowerment, choice and control over your direction, goals and engagement. So, the Trevor Parry Centre program process. So, session 1 is an intake assessment. So, an appointment's made with one of the Trevor Parry Centre nurses to determine the level of dependency and considerations around their medications. Exploration of the reason why you might smoke and where you want to change your relationship with smoking. Excuse me. Getting information about smoking and quitting. And in the end, making your own decision. The next steps is an involvement of and conversation with your preferred team. This will include your psychiatrist, your GP, and other staff on developing a tailored program. Session 2 is titled Getting Ready. So, identifying triggers, short and long-term strategies, including nicotine replacement therapy, Quit Buddy, Quitline, free programs and apps, and having support from your nominated buddies. There are ideas developed and plans for change, including what to do when there's slip-ups and setting a date and starting out. So, barriers and enablers to supporting smoking cessation in mental health settings. Some of the barriers are no smoking support, family and friends who smoke, no access to NRT, smoking culture and norms, staff attitudes and implicit bias, consumer stress and boredom, task-rich, time-poor staff, enablers to seek helping individuals cease smoking, well-trained staff, working with fluctuations in motivation, having an integrated approach, preference-based support, bespoke smoking cessation programs, interventions targeting specific alternative coping strategies, protected time and space for smoking cessation to be discussed. So, what's our current state at the Trevor Parry? An audit of 12 discharges was conducted on CVIS. This looked at the first physical health assessment compared to the final physical health assessment. 2 residents had reduced tobacco consumption since being at TPC. 4 residents had increased tobacco consumption since being at TPC. And 1 resident had remained the same in tobacco consumption since being at TPC. Things to be noted from the audit. 5 patients had information gathered at 1 physical health assessment, but not the other. And there was a lot of variation in the way smoking information was collected. For example, was it collected by grams per week, per fortnight, dollars spent per week, per fortnight, or the cigarette smoke per day, per week? So the way the information was collated changed between clinician to clinician, so we had to work on trying to make that more consistent. Also, if a patient has a short admission, smoking information was not collected. So, okay. So now we're moving on to the lived experience perspective, which is me. Okay, so the topic of vaping and smoking is a significant issue within the mental health community, whether that be for consumers, family, friends, or supporting staff. People living with mental illness are far more likely to smoke cigarettes or vape. As you have heard, people living with mental illness are up to 3 times more likely to smoke than the general population. That's not just a statistic, it's a reality that impacts lives every single day. Smoking doesn't just harm physical health, it can interfere with medications, making treatment less effective, and it increases risks for heart disease, diabetes, and respiratory conditions. These are serious consequences that shorten lives and reduce quality of life. I want to share something personal. Quitting smoking had an immense impact on my health, not just physically, but mentally too. When I finally managed to quit, it felt like a huge achievement. I had more self-belief and more confidence in my abilities. The benefits were many. More money in my pocket, no lingering smell, no cough, more energy. For anyone living with mental illness, self-esteem often takes a hit. So when you accomplish something that makes you proud, it can have a powerful ripple effect across the rest of your life. It's not just about quitting a harmful habit. It's about reclaiming control and proving to yourself that change is possible. Working on my physical health, starting with quitting smoking, changed my path completely. Today I work full-time and even have a mortgage. Over the years, I've completed a master's degree and found a job that connects deeply with my own life experience. My journey wasn't fast. It was slow and full of small steps. But those steps added up to real change. Every milestone mattered, and every setback taught me something valuable. My passion for helping others quit or reduce smoking and vaping comes from my own lived experience. I want to support people to reach a level of wellness that gives them the best chance at a full and satisfying life. For many in the community, quitting might seem simple. Just apply yourself and stop. But for those living with a mental health diagnosis, it's not that easy. Addiction is complex. Nicotine isn't just a habit, it becomes a coping mechanism, a source of comfort during distress. Recovery is a journey of self-discovery, and every attempt teaches you something new about yourself. For me, quitting cigarettes was incredibly hard. I relied on them during the worst times. when the voices in my head were screaming about uncomfortable, unwanted things. In those moments, there's little you can do to feel normal or participate in life like others do. A cigarette gave me relief. It helped me appear calm in public, soothed my nerves, and offered a small sense of pleasure when everything else felt unbearable. When I couldn't sleep night after night, cigarettes were my comfort, my joy. Giving them up was the hardest thing I've ever done, and that's saying something. It took many attempts, but each time I tried, I learned something new about myself and why I had initially formed the habit. That's what I share with clients in the Beyond the Smoke program at the Trevor Parry Centre. Every attempt matters. Every time you try to quit or cut back, you learn something new. For me, oddly enough, keeping a packet of cigarettes with me worked. Knowing they were there if I really needed them gave me a sense of control. It sounds counterintuitive, but it helped me break the cycle gradually instead of feeling trapped by an all-or-nothing approach. Programs like Beyond the Smoke aren't just about quitting. They're about understanding triggers, building coping strategies, and creating a supportive environment. It's about progress, not perfection. If you're a clinician, ask about smoking habits. If you're a family member, offer encouragement without judgment. Every conversation matters. These small interactions can plant seeds of hope and change. I'm grateful for the chance to speak to you today and the benefits of prioritising physical health, even when it feels secondary to mental health. Quitting smoking can feel impossible, but the benefits are profound. It strengthens your mental health, boosts your confidence, and proves you can achieve your goals. For those living with mental illness, quitting smoking offers more benefits than most people realise. Everyone deserves the chance to live longer and healthier, and that's what Equally Well is all about. I embrace that fully. Thank you for listening and for supporting the journey towards wellness for all.
Wow. What can I say? I just think you've embodied the entire 2 days with that last half of your presentation.
Oh, thank you.
Unbelievable. Michelle. Stay on stage. Woo! That was just brilliant. And I really loved the way that in a number of different ways you said that every milestone mattered and every setback taught you something valuable. Many attempts, each time I tried, I learnt something new about myself. And also just that sense of power that came when, and I wonder if this also applies to that this is sort of a portal into so many other conversations.
Yeah, it is. It's like getting physically healthy. I mean, that's empowering too. These little things about improving your physical health are just so important in relation to your mental stability. It really is.
Unbelievable. Any questions, comments, shared experiences, stories? Yes, thank you. And I'll hold the mic. Yeah, I'm being a boss on the mic.
Hi, I'm Catherine. That was really great, and that, as you said, that the second half was I could really relate to. So just wanted to say I kept a carton of cigarettes in a top cupboard for 12 months.
Wonderful.
Just knowing they were there was good.
Yeah.
But yeah, it took me 3 attempts, and I actually walked the same path as you. So amazing. Yeah. So it isn't really counterintuitive. It just worked.
Yeah.
Interesting. Did I see another hand go up before? No, not yet. Oh yes, thanks, Ta.
Okay. The nicotine replacement therapies, are they funded? by you, or do the participants have to be? Because that's the biggest barrier.
I know.
The medicinal vape is fantastic. That's how I quit after 30 years of smoking.
Yeah.
I was on.
No, at the moment, they're not. At the moment, they're not. And there was the old NIFSA used to run a smoking cessation program, and they did, if you attended for a couple of weeks continuously, they would give you NRT.
Just stay on the mic.
Yes, sorry. But our biggest barrier has been chop chop, which is the illegal tobacco, because people can afford it more easily. And we've had more success with people that don't like the taste of chop chop.
Yeah, that's interesting. Look, that was a fantastic presentation. Thank you. Yeah, and I think I don't want you to halt your applause. So, but I would love to see, if you were willing, that piece put somewhere and distributed through your website, the Equally Well website or something. Like that should be published. What you just said. Yeah, that story, that first person story would just people would. Yeah, I think that will have impact. Thank you, Michelle.